Hey guys, back again with another training day. We're going to start with the core again, working through the same stimulation techniques, and then we're going to progress from there. So, starting with the towel. Again, if you want to learn some more, you can look back at the previous videos. This is stimulating the sensory component of the motor nerve of the core musculature. This will light up that nerve and it will facilitate more of a contraction of those muscles. Ribs, pelvis, lower area, and up. Okay, that's good. Since I've been doing this for a while now, the core fires right up right away with that stimulation. Next, we're going to do some fascial activation with the jaw. So, moving it side to side, you want to keep it smooth, back and forth, no pauses at the end. The more that I've been doing this, again, I'm feeling it more in the core. Next one, we're going to push in the jaw forward and backwards. And you can pause at the end with these. And we're going to mobilize the upper portion of the jaw. You're going to be pressing up when you breathe in and pressing down on the ridge of your nose. Tip the head back. That's good, and all those can help facilitate the core activation. Next, we're going to do a near-far drill. So you bring your eyes in and far out. So you can use your thumb or your finger, bring it close, look at that, then look at a target in the distance. It's a great way to stimulate the brain to help facilitate that core activation. The target in front of you needs to be close, within 3 feet or so, and the target in the distance, you want to look at something further away, around 10 feet or farther. Now we're on to the abdominal fascial stimulation directly where the obliques and the rectus abdominis meet. So keeping the ribs down, knees are up to help tip that pelvis backwards, and we're going to dig our fingers in to that fascial line. Really move it around. And come out of it. A little break, and then right back into it. Keeping those ribs down is very, very important. Now this is the core position you need to progress to the higher level exercises like the handstand and other gymnastic or calisthenic type movements. Coming out of that one, we're going to go right into that tucked hold position. Very similar, just lifting the knees up towards the chest. There we go. I can tell as I'm progressing in my recovery that this is getting easier and easier. And that goes for anyone. The more you work on this and give yourself adequate time to recover, the easier and easier it will become because you are getting stronger and your body is adapting to the stresses that you placed on it. Another set. Out of it. The progressions are coming along well. Do one more set of these. Make sure you're squeezing your legs together. Gotta keep your shoulders down towards your waist. Then out of it. We're back with the chairs again. I'm going to be pushing up, again lifting here as high as I can, keeping those knees nice and tucked. Here we go. You want to hold as steady as possible, keep it nice and controlled. Doing another set. little more fatigued today, that's okay. Not every day will be a personal best, but the important part is that you get some training in on your training days, and especially your high performance recovery days. We can go more into the types of training days for improvement in training later. Last one. The next exercise is a straddle pulse. So we're going to be lifting the legs. The full straddle is like this, and then lifting the legs up. For my heart surgery, they went in at the hip, so the surgical site is around that area where the hip flexor is. So I want to be careful as we progress. We're going to regress this exercise. We're going to sit back like this, and we're going to do one leg at a time. Then we can progress later to both legs. I'm going to start with my non-surgical side. All right, we're just going to start with 5. Work it out a little bit. And then we're going to go to the other side. Do another set. Now, some cramping is okay as the muscles are getting used to this type of exercise. It's perfectly normal. All right, other leg. Great way to strengthen those hip flexors and mobilize those hip muscles, especially with lengthening the hamstrings and some of the glute complex as well. We'll do one more set. And back to the other one. We're back on the bike again. My recovery score was really low today, only 67%. So we're dialing it back to zone 1 training again, and we're gonna go for 20 minutes and see how that goes. I can tell I'm feeling really tired today. These are the days you need to allow yourself to recover and restore from the previous day's activity. Otherwise, if you don't recover, you can't continue to improve. If you continue to push yourself, then you will most likely get injured and it'll lead to overtraining. And if you overtrain far enough, then it can take up to 2 weeks or longer to fully recover from it. We're in the warm-up right now, getting started. Here we go. On the cool down now, it was challenging to keep my heart rate in the range for zone 1, which makes sense because my recovery score was so low today. But I do feel a bit better. That is the purpose of high performance recovery training sessions. So that's all for today. See you next time.